Hi, my name is Mario, and I've been a clinical research associate or a CRA for over 10 years. In this video, I would like to talk about the difference between what a CRA does, monitoring, and what a quality assurance person does, auditing. So this video is really going to focus on the difference between monitoring and auditing. And the reason I thought this would be an appropriate time to make this video is because I'm actually in the process of interviewing for both roles. I was let go from my most recent position due to COVID-19. And as I'm interviewing, I've gained a wealth of knowledge, and I would like to share it here. So, monitoring, which is what I have the majority of my past experience in, is when a person goes out to a clinical site, a hospital, and really looks at the details of a clinical study and seeing how it is implemented at that hospital. For example, they may look at all the data being captured in a 100% source data verification model. And that just means that for 100% of things that are put into an electronic data capture system, the CRA would be responsible for making sure that it's correct, that the electronic medical record support it, that paper documentation supports it, that there isn't missing data, that there isn't incorrect data. Beyond that, they would also look at regulatory documents, ensuring that all the required regulatory documents that are needed are there, and that any approvals that need to be obtained are there. They'd also look at things like the investigational product and IP and do accountability, making sure that the bottles that were dispensed correctly according to an electronic system that assigns bottles to be dispensed to patients, and that what was expected to be returned has been returned appropriately. But if you step back and look at this from a broader picture, what the monitor is doing is really getting bogged down in the detail to making sure that the study at a site in all aspects is being carried out correctly. And monitors will generate monitoring reports that include what are called action items, and the action items go out to the site to basically tell the site what needs to be fixed. So you could have a variety of different types of findings during a monitoring visit. For example, missing training records. There could be queries that were not resolved. There's a number of things you can put into a monitoring report. Once you do that, then you continue to work with the site to try and close whatever you've identified and try to work with them to make sure that their site is meeting a quality standard from the terms of looking at every single minute detail. CRAs in general tend to be an obsessive individuals, so they tend to pay a lot of attention to detail. And I've often seen the CRA job compared to someone who's looking at a tree and then looking at the branches and then looking at the leaves and really going going down to the finer details. And I think that's really apt. That is what a monitor does. They take one tree and then really start to dissect looking at the smaller parts of that tree. Auditing, which is the other side of quality, is different. Auditors are tasked with looking for systematic issues. And the way this works is the auditor will usually choose a subset of patients. And this is built into something called the audit plan that the auditor would have to follow in helping them guide them to which patients should be selected. And when they're looking at patients at a site, what they're looking for is there something systematic that is contributing to problems at this clinical site or hospital? And as an example, on the monitoring end, the monitor might say, hey, there's this deviation and that deviation from the protocol that the site is supposed to be following. From a quality perspective and an auditing perspective, you may say, all right, the monitor has noted high levels of deviations from the site, but is there a trend here that we can see? Is there something that can help sites improve? Is this a systematic issue? Is this a site issue? Is this at a protocol level issue where the protocol may have not been written as clearly as it should have been? So auditing really focuses on trying to see the bigger picture. And I often see auditing compared to examining the forest and taking a survey of the forest. So rather than just looking at one individual tree, you're now surveying the forest to try and get an idea of the broader picture. So, like I said, these are really two complementary functions. To get a solid assurance of quality, you have to have both monitoring and auditing. So they work hand in hand, and they are both great roles for people interested in clinical research. I think starting off, you would more likely gravitate toward monitoring positions. As you get a little more experience, you would look a little more toward quality assurance. And I'm at that juncture in my career where I know monitoring really well. And what I would like to do is expand my skill set. So I've worked with auditors, but I've never been the auditor, and I've never looked at audit reports from a perspective of critiquing them. I've looked at them in the perspective of saying, "Hey, here's the audit report. I'm the monitor. These are the issues that are found. Let's work with the site to resolving them." So hopefully that gives you a good idea of what the difference between monitoring and auditing is, and what the difference between the clinical research associate role of monitoring is, and what quality assurance role of auditing is. As always, if there's another topic you would like me to cover, please add it down in the description. Thank you.